Good morning, everybody. To 8 p.m. last night, there were just over 95,000 tests done in New South Wales, and it's really important, as we always say, to keep those testing rates high. To 8 p.m. yesterday, there were 262 cases of community transmission, with at least 50 of those infectious in the community during that time. And as we've seen in the last few days, the numbers are bouncing around a bit, but clearly reduce those numbers, and I urge everybody to please stick to the rules, follow the health advice, and only leave home if you absolutely have to. Unfortunately, overnight there was one death of a woman in her 80s who was not vaccinated, and Dr McAnulty will provide further information about that. In relation to the virus, Canterbury Bankstown local government area still remains the epicentre of the most cases. Obviously, all local government suburbs within the Canterbury Bankstown area and adjoining areas are under risk of transmission. It's again creating the highest number of cases, and as Deputy Commissioner Warboys will outline, that has been the focus also of police compliance with extra presence on the ground, making sure people are doing the right thing. On a more positive note, health experts advise us that if people in the Georges River confidence to take the Georges River local government area out of those areas of concern. And congratulations to people in that area who've been following the advice, doing the right thing, and have seen a reduction in the number of cases. Regrettably, however, there are 12 suburbs in the Penrith local government area that will be now listed as an area of concern and will be subjected to those harsher restrictions that we've imposed on those 8 local government areas. Dr McAnulty will read what those 12 suburbs are, but they're clearly suburbs that are boundaries to those other 8 local government areas, and we want to make sure that we stem the tide of the virus seeping into those additional communities. And as I said, Dr McAnulty will read what those 12 suburbs are, and we ask residents from 5 o'clock this afternoon to adhere to the additional restrictions placed upon them. Pleasingly, New South Wales now has made sure that there are 4.4 million jabs in arms. Now, that is positive. We're doing really well in terms of increasing the number of people getting vaccinated every day. And can I urge everybody who hasn't had at least one dose of the vaccine to come forward and get vaccinated. Every adult should be coming forward and getting vaccinated, and we urge everybody to please do that. As you all know, in Homebush today, we're focusing on any worker who works in supermarkets or face-to-face food retail. There are thousands of people who've already booked to come in and get their jab today, but it's also allowable for people to walk in today. If you want a jab, especially if you work in frontline food services, please come forward today to Homebush and get a jab. The vaccination centre there is open till 4 p.m. And whilst we do have a couple of thousand bookings already, there is capacity for people to come forward. It's a rainy day. If you don't have symptoms and you're not in isolation, you're not a close contact, and you're not someone of concern, please come forward and get the jab. Can I also stress again how important it is for us to fight this outbreak through the lockdown, through everybody doing the right thing, but also through getting vaccinated. And they are the 2 tools we have to reduce the case numbers and look forward to a future which has fewer restrictions. And I really, really urge everybody to stay at home unless they absolutely have to. And secondly, of course, come forward and get the jab if they haven't. Dr McAnulty will now provide the health update, and Deputy Commissioner Warboys will talk about police compliance efforts. Thank you.
Thanks, Premier, and good morning, everyone. There were 262 locally acquired cases of COVID-19 reported in New South Wales to the 24 hours to 8 o'clock last night. There were also 6 overseas acquired cases to 8 o'clock last night. There were 95,480 tests reported until 8 o'clock last night, compared to the previous day's total of 108,449. In terms of cases in hospital, we are seeing large numbers of people with COVID admitted to hospital. There are 362 cases admitted to hospital, with 58 in intensive care and 24 requiring ventilation. Of the 58 cases in intensive care, 5 are in their 20s, 7 in their 30s, 4 in their 40s, 17 in their 50s, 7 in their 60s, 15 in their 70s and 3 in their 80s. So young people are certainly getting caught up with this disease. Of the 58 people in ICU, 54 were not vaccinated, 3 had received their first dose of AstraZeneca, and 1 had received their first dose of Pfizer vaccine. Sadly, as the Premier mentioned, New South Wales Health has been notified of the death of a person with COVID-19 who's a woman in her 80s. who was a resident of the Wyoming Residential Aged Care Facility in Summerhill, and she died in Royal Prince Alfred Hospital. She tested positive for COVID-19 on the 1st of August and was admitted to hospital that day. We extend our sincere sympathies to the family and loved ones of that person. She was not vaccinated. We've had positive sewage detections in Dubbo and low levels in Mudgee, so we're asking people to come forward for testing in those communities. There's no known cases in those communities, so we need to be extra vigilant wherever we see sewage in communities without known cases, so that please come forward for testing if you have even the mildest of symptoms if you live in Dubbo or Mudgee. The Premier mentioned additional restrictions for 12 suburbs in the city of Penrith. Now we've seen the front of the epidemic move into parts of Penrith adjacent to the areas in Western Sydney and southwestern Sydney. So we're concerned, and the additional restrictions will help contain that outbreak emerging there. The suburbs affected, which are adjacent to Cumberland and Liverpool LGAs, Caddens, Claremont Meadows, Collyton, Erskine Park, Kemps Creek, Kingswood, Mount Vernon, North St Mary's, Orchard Hills, Oxley Park, St Clair and St Mary's. In line with the restrictions currently in place in Blacktown, Campbelltown, Canterbury Bankstown, Cumberland, Fairfield, Georges River, Liverpool and Parramatta LGAs, people in these 12 suburbs must only obtain food or other goods and services and exercise within 5 kilometres of their home. You can't travel to other areas of work outside those areas unless you're an authorised worker. Masks must be worn whenever you're outdoors, except in a common outdoor area of a backyard apartment, for example, and masks do not have to be worn while you're in a car with other members of your family. Thanks very much.
Good morning. Thank you, Dr. Premier. 454 penalty infringement notices issued right across New South Wales in the last 24 hours by police. 171 of those were issued in southwest and northwest Sydney. Police continue to have a focus in the Canterbury Bankstown and Campsie area. Yesterday, whilst the vast majority of people in that specific LGA were doing the right thing, police were still confronted by people who were outside of their homes without a reasonable excuse, buying simple goods but then hanging around and talking and gathering and putting not just themselves at risk but their family at risk, where they would return home and they could well spread the virus. It's unfortunate that this focus continues, and it will continue until such times as the infections and the transmissions in those areas begin to fall away. New South Wales Police every single day look at where the infections, where the transmissions are, what are the LGAs of concern, and they task police resources to those areas. The agility of New South Wales Police is right across New South Wales. We will move resources around. That's local resources from districts and police area commands, traffic and highway patrol, other specialist police, and continued focus on our transport system. Yesterday we also seen along the beaches. We now have an operation that works every single day on the beaches, the Sydney beaches, up and down, making sure that people who are exercising continue to do that they are not gathering in spaces that again poses a risk to themselves and the community. New South Wales Police would like to thank those people in southwest Sydney that continue to do the right thing and make our job easy, but the message is really clear. If you are one of those people that want to go outside of the public health orders, if you are one of those people that want to put the risk in terms of your own safety, that of your family, that of the community, we will issue the infringement notices, we will direct you to comply with the public health orders. And I guess what's important is that Crime Stoppers continues to receive around 1,000 calls every single day from people in the community that want to tell us about those that are breaching public health orders. It's not just in terms of your own actions, but what you are doing is actually putting the actions, it's not just your own actions, but it's what you're doing to your community, to your family, and to this state. Every single person wants to get out of this pandemic, wants to get out of the lockdown arrangements as quickly as possible. Don't be one of those people that put that at jeopardy. Thank you.
I'm just trying to get my head around the science. Clearly, the statistics show that the vaccinations are preventing people from getting serious illness and being in ICU. I mean, that's just pure mathematics. To what extent are vaccinations preventing people from even getting the illness?
Yeah, so vaccinations work well. The best effect is for preventing serious disease with very high rates of preventing people getting into hospital. They also work well in preventing disease and infectiousness to other people, but that's at a lower level than the main effect. The highest level of effect is in preventing that serious disease, but they do and are very effective in preventing infection in the first place and your ability to transmit to other people.
Dr. McAnulty, these 12 suburbs within the Penrith LGA, they're under the same restrictions as the other LGAs, right? And that includes you can't leave for work unless you're an essential authorised worker.
That's correct.
Does that mean that they can't leave their suburb, or they can't leave the Penrith LGA?
They can't leave the Penrith LGA to go be an authorised worker. So you can go. The rules are on the website, but you need to get food. You can leave your house one person at a time, one day. You can leave the house to get food. You can leave if you're an authorised worker, leave the LGA to do authorised work.
But they can go out of their suburb within the 5 kilometres to shop, and they can go out of their suburb if they're an authorised worker to work within the Penrith LGA?
That's correct.
Dr. McAnulty, can you tell us the proportion of healthcare workers that are vaccinated?
I don't have that figure. We can get that back to you at the moment. I don't have it in my head, but certainly healthcare workers are offered vaccination, and we've got higher and higher levels of vaccination in healthcare workers. And of course, this is the most important thing you can do as a healthcare worker is get vaccinated, as well as following excellent infection control practices. So we've got great training in our health system for health workers and awareness and offering vaccine to healthcare workers.
Doctor, do you have another positive case at Royal North Shore or Northern Beaches? Sorry.
I don't. We'll have to get back to you about the detail. We do have cases in Northern Sydney, and we have cases in the media release. We have identified where the cases are.
But there's not a concern within the Northern Beaches Hospital of a positive case presenting there?
I don't have information at this point.
Doctor, you've got vaccination hubs at Macquarie Fields, Homebush, and you've mentioned Penrith. Is there any desire to have a mass vaccination hub out west?
Should I let you take that? Sure. Yeah, sorry, Premier.
Well, certainly we have a number of mass vaccination hubs up and running already. So obviously from tomorrow, Kudos Bank Arena also will become a mass vaccination hub. Initially we'll be doing the HSC students in those areas of concern, but then following this week, that will be reverted to a mass vaccination hub. We have a walk-in hub at Prairie Wood. We also have a number of mobile hubs. So we're advertising or promoting to local residents in those areas of concern, places where there are mobile walk-in centres as well, around places of worship, community centres. So we're doing both strategies, mass vaccination hubs, working with the GPs, working with the pharmacists, but also having those mobile hubs as well where people are comfortable coming forward. We're essentially covering all bases to make sure that whether it's a mass vaccination hub, whether it's through your GP, a pharmacist, or those mobile places going out to the community through community outreach, that we have our bases covered, including working with industry. And can I thank industry for their enthusiasm in trying to get their workers vaccinated. It's pleasing to note that thousands of workers in supermarkets and food retail across those areas of concern are coming forward to get vaccinated today. And I want to call out to any others who may not have booked. The Homebush Centre is open till 4 p.m. today, so I urge you to come forward and get vaccinated, especially if you work in those industries. We're really keen to vaccinate all of our authorised workers, all those people who have to be mobile but who may be living in those areas of concern and unfortunately at highest risk of either spreading or getting the virus, and that's what we're trying to reduce in the next few days.
Remy, can I ask you about the construction industry opening up on Wednesday? Can you give us some clarification on what the rules will be? Free-for-all, rapid antigen testing on site, what are we going to be looking at?
Well, certainly information has already been provided publicly on those matters, but in relation to the construction industry, can I thank the industry for working closely with government and for working with us to make vaccinations an incentive to get back to work. So if you live in one of those areas of concern, you're in the construction industry and want to get back to work, we're urging you to work with your employers to get vaccinated to ensure a safe return to work. And please know that whilst there isn't any rules in place to mandate vaccinations, there will be incentives offered for people to get back to work and to get back to doing what they want to do if you are vaccinated. So can I urge people now to come forward and get vaccinated, especially if you're in a job which traditionally has a lot to do with people, has a face-to-face contact. We know that the vaccine takes 3 weeks to become effective, either vaccine. So we encourage you to get vaccinated as soon as possible so that we have options moving forward into September about how we can live more freely.
Premier, has the government considered, or would it be helpful to look at door-to-door vaccination rollouts? Medical professionals going door-to-door in some of these people who are stuck at home? Well, the best option for us is to vaccinate large numbers of people in the shortest amount of time. So the max vaccination hubs are working really well. The take-up with pharmacists and GPs is working really well. People obviously trust their GP and trust their pharmacist for that additional information, and they're familiar to them. So we're responding to what has the best health outcome, but whatever also is responding well through the community, and we're considering all those options, but please know that you need to be careful when you consider door-to-door to make sure that you're not exposing people to the virus, and that's why it's really important for us to encourage people to go through their GP, go through their pharmacist, book into one of our mass vaccination hubs, or through their communities. We're providing information at a grassroots level as to where those mobile vaccination hubs are and how people can go to a trusted place they've been to many times in order to get the vaccination.
New South Wales Union surveys just revealed that about...
I'm sorry, I didn't catch the first part of the question.
A New South Wales Union survey of about 3,000 essential workers has revealed that about 50% of them say that they feel unsupported throughout this outbreak by their employers. What is the government doing to offer them support? And also, while I've got you, what do you say to the mass misinformation that's spreading about vaccines on social media and the accusations that the government has an agenda with promoting the vaccines?
Yeah, firstly, can I thank the industry, the business community for working with government. We have found overall their response to be extremely positive in supporting their workers to get vaccinated and keeping their workplaces safe. So whenever we have had conversations with business and industry, they've been very encouraging in relation to vaccinating their employees and making sure their employees have the opportunity to be vaccinated. That has been our overwhelming response, and we urge every employer to consider the well-being of their employees and workplaces. And of course, it's in everybody's interests, because if there is a COVID outbreak in your workplace will be closed down. So there's incentive for people to operate safe work environments, which is obviously good for employees, but most importantly good for employees as well as employers, and that is critical. In relation to misinformation, there'll be misinformation on a whole range of issues, including vaccination. So I always say you don't need to listen to me, but you do need to listen to the health experts. Speak to your GP, your pharmacist, your community leader who's been provided with information. We have targeted grassroots information to so many diverse communities. There's over 200 different communities of diverse backgrounds in Greater Western Sydney, something our state's very proud of, but also something that we need to acknowledge. And so we've had very targeted approaches through community leaders, through people who are respected by community groups, and that has proved really useful as well. So we ask you, if you have any concerns, please ask your GP, your pharmacist, or of course contact New South Wales Health.
Premier, would you be open just to giving an update on your views about what might happen post-August 28, cases and vaccinations notwithstanding?
Yeah, look, we're tracking well to hit our 6 million target, and we are now in our 40s in terms of 40% range in terms of people with 2 doses in New South Wales, or at least 1 dose. So we're sticking to our targets, and I'm really keen to get to 6 million jabs by the end of August, because that will provide us opportunities to consider what life looks like in September, and we're really keen to really sprint this is a race. We're keen to sprint to get those vaccination rates up because, as Dr McAnulty and health experts say, not only does it keep people out of hospital, but it also prevents the virus spreading, prevents people getting the virus. And we know that life will look very different once we get to 70% vaccination and 80% vaccination. But until we get to 70%, we need to consider what restrictions will be in place until we hit that target and how can we live more freely than we are now today. And I want to be very clear about that. It doesn't mean that we'll return to pre-outbreak conditions, but what it does mean is that September can be a month where we have greater freedom than what we do now. But there are two things conditional on that. It's making sure that we keep case numbers as low as possible, plus we keep vaccinating. And we know the future, freedom relies on vaccination, and there's no doubt about that. But it also means having to suppress. The lockdown is an opportunity for us to suppress and get those numbers down. But we know that life with the Delta strain means some level of restriction until we get those vaccination rates as high as possible.
Premier.
Sorry, you haven't asked the question.
Premier, just in terms of getting to that 6 million target, I think everybody's working towards that, but we don't know what we get for the 6 million. Is there something that you're looking at? Is it schools? You say schools is a priority, getting people back to work. Are they the first things that you're looking at for the 6 million target?
Well, obviously for us, our priorities as a government are getting face-to-face learning back, but also getting workers back to the workplaces. And that means a whole number of things. If certain categories of workers go back to work, it also means that all citizens will have access to perhaps services they don't have access to today, and that's really keen for us. So it will really depend on the advice from health experts, but we are looking at opportunities in relation to education and work. But having said that, when you get people back to work, it could be an industry where people rely on for service in that industry, and it could have a benefit as well to citizens. So we're looking at those options. But can I please urge people to come forward and get vaccinated? I can't stress that enough. If you have concerns, please speak to your health professional, your GP, your pharmacist that you trust, or else contact New South Wales Health. But higher rates of vaccination will help us deal with this outbreak. It's not the only answer. We've never said that. Obviously, lockdown and restrictions have their role, but vaccination is the key to reducing the spread, to reducing the number of people that need hospitalisation. And we've seen to date, as horrible as every death is, there still hasn't been a death where people have received both doses of either vaccine, and that's something positive. It means that the vaccine is having a positive impact, and I can't urge people enough to come forward and get vaccinated.
Premier, regarding the construction workers in the hot zones, how will you check if they've been vaccinated? How will you know?
Well, obviously, there is now an application through Medicare that provides you with evidence that you've been vaccinated. There's also proof of vaccination you can receive when you get vaccinated. So there's multiple ways, and this is about employees working together to substantiate compliance. But we're very pleased that industry supported the government's view that vaccination is key to having COVID-free workplaces, especially in those areas of concern. So whilst those obligations or those incentives don't exist for people outside those areas of concern, given where the numbers are, if we want workers back in the workplace in a safe way, well then obviously vaccination is key to that process. It's a combination of vaccination but also testing to make sure that workplaces are as safe as possible. And I want to thank industry for supporting those incentives. Nothing is mandatory, but we know that if we encourage people to get vaccinated as a way of getting back to work, that is really encouraging people into the future.
Premier.
Alex and then James.
On testing, there's an exposure site in the Port Stephens LGA. People are being encouraged to come forward and get tested. There's no Sunday testing facilities in Port Stephens. Why is that, and what happens for those people?
I don't know the answer to that question, but we can look at it. Port Stephens health testing. Yeah, we'll look into
Sunday testing.
Yeah,
Port Stephens.
we'll look into that, but I wasn't aware of that, Alex.
So what do those people do today?
That are being told to come forward and get tested?
Well, obviously, if it's 6 days out of 7 at the moment, I don't know about that 7th day, but we'll take advice on that.
In relation to the cases today, right, only 86 cases were in isolation for their whole infectious period out of the 262. Dr Chant on Thursday spoke about the fact that there is more that the government can do to intervene in transmission of the virus. She's been talking to Paul Kelly, her Commonwealth counterpart, about a circuit breaker. Apart from increasing vaccination rates, is there anything, or will you do anything more to intervene in transmission paths or not? And if not, will you level with the people of New South Wales to say that we're going to be locked out of the rest of the country until the whole country gets to 80% of the population being vaccinated?
Well, no. Can I firstly say this, that Dr Chant confirmed with me her conversations with her federal counterparts on the need to get us more vaccines. She's been very open about that. I've been very open about that. We know that vaccination is a key tool. It's a tool we didn't have a year ago. It's a tool which Australia didn't have some time ago, but now we do have the tool, and it's important for us to use all the tools we have in order to curb the number of the spread, to curb the number of people getting the disease, but also obviously to keep people out of hospital. And we know that once you have a certain population vaccinated, that will also mean that we focus more on hospitalisation numbers as opposed to case numbers. And that's really important. It is really up to us as to how quickly we get vaccinated. It's up to us as to how quickly we can look forward to additional freedoms. And that's why I say to the community, please know that our government, your government, is focused on higher vaccination rates as a way of us having greater freedoms in the month of September. And that is something that we're really looking forward to.
Those additional freedoms only come with vaccination rates, double dose vaccination rates of 70 or 80%.
No, that's not correct. The Doherty report is very clear. Those rates of 70 and 80 refer to freedoms pre the outbreak. But we are currently in lockdown. Lockdown plus some level of easing of restrictions is possible once we get to 50% or 60% rates of vaccination. And I want to be very clear about this. Some people are conflating the two issues. So the Doherty report is an outstanding report which the New South Wales government supports. And of course, what it does is suggest that once you get to 70% vaccination, you can then focus on the number of hospitalisations as opposed to the number of cases. And that's really a mind shift on how we live with COVID. But until we get to 70%, there's opportunities for us to ease restrictions currently that we don't, or to ease restrictions that are currently in place once you get to a certain level of vaccination. And that's a different proposition, but one that New South Wales is looking closely at. And I made those views clear at National Cabinet last Friday.
You're completely at odds with the Prime Minister here, who says that
not at all.
The lockdown
in fact,
to work, the lockdown needs to work. You can't vaccinate yourself out of a lockdown.
In fact, the Prime Minister at National Cabinet, and he said it publicly afterwards, acknowledged that because New South Wales is in lockdown, if we hit certain vaccination targets, we can ease some restrictions. It doesn't mean you get to what you would ease if you're at 70%. But there's certainly opportunities for us to look at what we can ease in September, so long as we hit our vaccination targets, so long as we get at least 6 million jabs by the end of August, we can look for opportunities as to how we live in the month of September.
Just in terms of Armidale, it's obviously now in lockdown. Have we got any information? Are there any more cases there? Have people there turned out for testing?
Yeah, I understand there's one additional case there, which is in the media update that Health will be providing. And obviously Health will advise us what should happen at the end of that lockdown period.
Today's drop in cases, is that a sign, do you think, that the tide has turned or tide is turning? What should we interpret anything from that?
Well, no. I think, unfortunately, a day doesn't make a trend. The numbers are clearly bouncing around, and we want to see them consistently go down. At the moment, it's a bit inconsistent. Although we're not growing exponentially, there's always concern about that tipping point where you start to see exponential growth. We certainly haven't seen that, which is one positive, but obviously a trend is if you have successive days of a reduction in numbers, and we don't have that yet. It's only a day, but obviously, as the days go past, the more people that get tested, the more people that come forward and get vaccinated gives us our best shot, literally, of reducing the case numbers overall.
Where did you get? Premier had a positive case at the Boggabri coal mine. Any chance the Northwest could go into lockdown?
I did hear about that case, but health experts are looking at that, and we haven't received any advice to that yet.
Where did you get this 50% vaccination figure, your figure of 6 million target, most of those first doses, some second doses, 50%? Where did you get that from?
The New South Wales government has observed carefully what is occurring in overseas jurisdictions. Our health experts, in fact, have been in touch with what is happening in places like Canada, in provinces with a similar size to New South Wales and what they went through. And clearly the evidence shows us that a targeted vaccination strategy in areas of concern has a massive impact on reducing cases and allowing you to get outbreaks under control, but also what life can look like. If you look at overseas jurisdictions, they've certainly been far less conservative than us as to what they've allowed people to do at 50%. But the difference with us in New South Wales and Australia is fortunately until this point in time, we've had a much lower mortality rate and much lower case numbers than other places around the world. And so therefore it's really important for us to look at what is acceptable for New South Wales and Australia in terms of what we do ease moving forward. But I do also believe, based on the health advice, that when you get to 50%, 60% vaccination rates, it does give you opportunity to ease some restrictions ahead of that 70% number when we literally have a change in thought. We transition from going from talking about case numbers to talking about hospitalisations, and that's a big shift. But we have some time ahead of us to make sure that all of us are comfortable in talking about it in that way. And as Dr. Chan and Dr. McAnulty and other health experts will say, we'll get to a stage when you have those high rates of vaccination where you can start treating the Delta strain as you would the flu, where you talk about the number of people in hospital as opposed to the number of cases. But we can't do that until we get to that 80%. But between 70 and 80% vaccination, that's what the Doherty report says. And I really do commend that report. I found it a very useful piece of information coupled with the information we've been having from New South Wales, and I dare say that the New South Wales health experts were talking about that 80% vaccination rate in adults for some months, even before the report came out. So it really validated our understanding of where things are going, but it also validated our understanding of how vaccination is an important tool in curbing outbreaks, but also obviously allowing us to live more freely moving forward.
Mr. Warboys, can I ask you about... You go.
Sorry, so if the numbers don't move, the case numbers don't move at all, but we do hit the 6 million vaccination target, you will look to easing restrictions?
Well, the other thing that health experts will look at is where the concentration of cases are occurring. And at this stage, the concentration of cases, whilst we've had outbreaks or clusters exist outside those areas, the concentration of cases is not in dispute at the moment. We know where the extra concentration is. That's why police have in large force, and I don't apologise for that, have really clamped down on those communities where some people, unfortunately, not a lot, but a handful of people are willfully not doing the right thing. So police have been given all the resources and are experts in those operational matters to make sure that we really clamp down on compliance. It's become very obvious to us in the last few weeks where the challenging areas are in terms of the virus circulating, what we need to do. And as every week goes by, we're learning the way Delta is working, the way Delta is moving, and the way in which we can stem that tide.
Mr. Warboys, can I ask you
Mr.
Warboys, just a question about compliance. In the early days of this, you were giving people the benefit of the doubt, like on the coalface on the front line, giving them a warning if they hadn't been pinged before, etc. These are daily warnings at these press conferences alone. Is it time that if somebody's sunbaking on a beach, they just get fined regardless of whatever their excuse is? Do we need to get harsher in those beach areas that Manly and Bondi, that don't seem to be taking it as seriously as the rest of the city?
I think the fact that the penalty infringement notices continue to go up every single day is disappointing, but it's a reflection on New South Wales Police attitude towards people that do not want to comply with the public health orders. As we continue along, it's not just the beaches, it's not just southwest Sydney. We now look at Armidale. We now look at the Newcastle and Upper Hunter area. As I said, the Police Operations Centre is there every single day to work with health about where the risks are, and they will task police to those areas accordingly. We have had a shift in terms of our focus, but as the Premier said, that shift clearly correlates to people in a specific area where there is high transmission who simply do not want to do the right thing. And we don't make any apologies for that. New South Wales Police will continue to be in those locations where we see there is a need to enforce the public health orders.
Just quickly about suburbs.